Speaker, over $1 billion in support for veterans was promised by this government, approved by Parliament, but never delivered. 8 specialized service centres were closed. Hundreds of frontline support staff were fired. Mental health wait times for vets stretched for dangerous months and years. But the minister increased his political staff fourfold. He increased his advertising. He paid hundreds of thousands of dollars to bonus senior managers if they slashed veteran services. By any decent standard, how is that acceptable?
The Honourable Parliamentary Secretary. Mr. Speaker, while the opposition wants to increase government bureaucracy, we're increasing frontline support for our veterans, Mr. Speaker, including recently announcing 8 new frontline mental health clinics for Canadian veterans, Mr. Speaker. In the service delivery branch alone, we reorganized 3 regional management centres into 1 in Montreal, Mr. Speaker, and reduced hundreds of managers, processing analysts, and administrative support clerks, Mr. Speaker. In the treatment benefits program, 30 positions were reduced when we streamlined health-related travel claims, Mr. Speaker.
Member for Wascana.
Mr. Speaker, 1 year ago, retired General Rick Hillier said this, and I quote, "Many of our young men and women have lost confidence in our country to support them." He was talking about PTSD among Canada's veterans. More have been lost to suicide than on the battlefields of Afghanistan. General Hillier called for a public inquiry. Not 1, but 2 veterans ombudsmen have also sounded that alarm. But a year later, the Auditor General says the same problems persist. How can this minister sleep at night knowing that his failure is responsible for this mess?
The Honourable Parliamentary Secretary.
Mr. Speaker, our government released the Veterans Affairs Mental Health Action Plan, taking action on the Auditor General's recommendations, Mr. Speaker. We have expanded frontline mental health support clinics across Canada, Mr. Speaker. We've cut red tape and doubled the number of counselling sessions, Mr. Speaker. This is just the beginning, and we look forward to working with our veterans to improve how we support them and their families, Mr. Speaker.